Welcome to the panel discussion of the Dravidian Professions Forum. Today we have an interesting and a very important topic for discussion, and that is the Dravidian model, the model that transformed the development trajectory of Tamil Nadu. The discussion is based on the book written by the speakers, distinguished speakers, Professor Dr. Vijay Bhaskar and Professor Dr. Kalaiyarasan, titled Dravidian Model, Interpreting the Political Economy of Tamil Nadu. In the past two decades, we had much discussion and literature on Kerala model, some discussions in Gujarat model and also Himachal model of development. However, in the last 5 years, we have increasingly discussing the success of Tamil Nadu through democratizing economic and political opportunity to its citizens. The Dravidian movement, led by Justice Party way back in 1920, which was succeeded by a social movement led by Thandai E.V.R. Periyar as Dravida Kalagam, and followed by political movement, the Dravida Munnetra Kalagam, led by Arinyar Anna, Kalaiyar Dr. Karunanidhi, made social reforms in such a way that opportunities are made available to everyone without any birth qualifications. While the communist parties, particularly in Kerala, had large success in bridging the gap between haves and have-nots, which led social development in large scale, that particular model based its understanding that economic inequality as the root cause of discrimination. Whereas in a country like India, with cultural differences and unequal social stratification, social inequality is the root cause for economic inequality, and even the labor is stratified on the basis of a person's birth, which resulted in discrimination. And social justice movement identifies this aspect that social inequality should be addressed to bring economic equality and thus to eliminate discrimination. Today, because of this approach, Tamil Nadu is in the forefront of development, be it education, healthcare, per capita income, women empowerment. Tamil Nadu tops the list, and all credit goes to Dravidian model. Our speakers are very well distinguished authors of this book, Professor Dr. Vijay Bhaskar, who is a professor of Madras Institute of Development Studies. He is also a visiting faculty at EHESS, Paris, University of Lausanne, Switzerland, a visiting fellow at School of Oriental and African Studies, University of London, and has taught at the IIT Madras. He is on the editorial advisory board of Oxford Development Studies and has also served as a consultant to the ILO, UNICEF, and UNRISD. I welcome you, sir. We have the co-author, who is also the other speaker, Dr. A. Kalaiyarasan, who is a post-doctoral fellow at Brown University, US, and also an assistant professor at Madras Institute of Development Studies. His academic interest lies in the intersection of caste and economic process in India, while his doctoral thesis explored the differences in aggregate economic and social outcomes in subnational states in India and how caste-based social mobilization weakened social hierarchy and made economic growth inclusive in Tamil Nadu. His recent works, in collaboration with Christophe Jeffrellet, explore the relationship between economic process and changing caste realities in India. I welcome you, Dr. Kalaiyarasan. We also have two guest speakers. One is very famous and leading Dravidian intellect, a senior parliamentarian from the Dravida Munnetra Kalagam, Thiru T.K. Silangovan, sir. I welcome you, sir. And a senior journalist, a well-known journalist, the reader's editor of Hindu, Thiru A.S. Panniselvam. Sir, I welcome you. Now, we will style this discussion in such a way that the speakers will make their presentations and the guest speakers can intervene at any point of time and make the discussion live. Now the floor is to the others. Thank you.
Good evening, everybody. Our sincere thanks to the organizer, particularly to Mr. Pugal Gandhi for making this event possible. We also thank Honorable Minister PTL Pranivil Tyagarajan, who not only encouraged us in many ways in our venture, but shared his insights on Tamil Nadu development experience and its constraints. Today, we are also glad and thankful that Honorable Member of Parliament, Mr. T.K. Silangovan and Mr. A.S. Panniselvam have taken the precious time to be part of this event. Actually, a question, I think that we should start our the motivation of the book. Why this, how do we enter? Okay, yeah. Because, if you look at across world, there is a concern. Broadly, the concerns are twofold. One, some regions do well, for instance, why Europe or America really do well in certain indicators, development pattern, standard of life. But whereas the poorer regions, Africa, Asia, and Latin America, do really poor in many ways. And also within those countries, there are some section of groups do really well in the sense, people of color, in the sense in the Europe, you will find whites, in America, you will find Anglo-Saxon white Protestants do well, whereas the blacks and Latinos do really poor in many indicators. Similarly, if you come to India, you will find also again, low caste, Dalits do really poorly in certain indicators, whereas the elite control most of the resources really do. Why this difference persists? Of by regions or by social groups. இந்த ரெண்டு கேள்வி தான் எங்களுக்கு வந்து main entry point to this book. So if you bring this debate into India particularly, we also see here எப்படின்னா ஒரு broad India is a union of states, subnational state itself, ஒவ்வொரு subnational state பார்த்தோம்னா ஒரு country போல யூரோப்ல இருக்க ஒரு country அளவுக்கு population இருக்கக்கூடிய states. Why this difference persists across regions within India? Some regions really do well in human development. Say, take the Kerala and Himachal Pradesh, but they don't do well in growth. But whereas some regions, take Gujarat and other, Maharashtra, some ministries do really well in growth, but do not do well in development. In the pattern, in the differences, divergences. The second question, fundamental questions to our book, which also we derive from the literature, is why in certain context, caste-based mobilization or other identity-based mobilization. அது வந்து ஜெண்டரா இருக்கலாம், அல்லது கலரா இருக்கலாம், எத்தனிசிட்டியா இருக்கலாம். Some contexts, that mobilization do not go beyond asking question of dignity. In the sense, it asks about the freedom and ending the discrimination, fighting for against discrimination. But actually, sometimes it gets confined to immediate caste identities or immediate social identities. It doesn't go beyond asking for more fundamental social economic transformations. So in the rent question, that is a driving force. It's entry point for us. In the sense, in India itself, if you take, as I mentioned earlier, broad development pattern, why actually Kerala and Himachal Pradesh doing well? This actually became a debate in 2040 election. Is led by famous economist Amartya Sen on the one hand, who actually saw a potential and a transformative role in development experience of Kerala and some extent even Himachal Pradesh, but did not see that potential of changing people's life or improving human condition in Gujarat, particularly, some extent Maharashtra, which otherwise really do well in growth. Whereas on the other hand, Jagdish Bhagwati, who is a well-known economist, argued, no, actually you do well in growth. Take the Gujarat. He said, in fact, he actually was fond of celebrating the Gujarat model in many ways, telling us, if you do well in growth, automatically you will have, in economic terms, there is something called trickle-down effect. You will have an impact on social life, human well-being, or other social indicators, including and health, education. So do not worry about the delay or, of just not focusing growth. Focusing growth alone would actually end up in problem. He thought that growth would actually lead to social development or, broader human well-being. But Sen contested that doesn't work given the experience at the global level and given the experience at India level, which actually become very much visible in the current pandemic, what we see in the experience. Why in certain regions? Of course, I'm not saying Tamil Nadu is really doing great or Kerala is doing great, but relatively, if you look at the experience, even at the pandemic time, the way in which health infrastructure is working, the way in which health professionals are working, the way in which the broad governance structure is working, you see there is a pattern. Either you take it Gujarat, the way in which Gujarat dealt with the cases, even if you take the way in which UP dealt with the cases. So definitely this pattern cannot be just explained in just terms of mere economic aggregates. So our entry point is to explain this. Tamil Nadu seems to be some way doing, combining this growth and development. How that became possible? What is the mechanism or the process that led to combining this growth and development? This is first question that we argue on this. We try to explain. The second motivation is, as I mentioned earlier, the social identity, particularly take an Indian case, we can't talk any development experience without talking about caste. caste தான் ஒரு fundamental question Indian context in terms of any everyday life. So then Tamil Nadu மட்டும் caste based mobilization நடக்கல, மற்ற ஸ்டேட்ல நடந்துச்சு. In the sense, in fact, last 30 years, 40 years, more debate was taking in more in northern states, particularly UP. UP, in fact, had a Dalit chief minister. In BR, you had a caste-based mobilization. So the question is, why then the caste-based mobilization in UP and BR could not deliver? There wasn't enough evidence, not only for our own work. This is another political scientist called Amit Aggregate, who has come out with the recent book. He argues that why UP and BR, which actually had a really better, in fact, mass mobilization of caste-based mobilization against indignity and discrimination, but did not deliver in terms of so fundamental transformation. Particularly what I mean fundamental transformation, I mean economic opportunities in terms of education, other jobs, and other forms of access to range of economic opportunities, social life, one can say. So this did not take place, whereas Tamil Nadu, you see a relative way, some way of it actually ended level of caste-based discrimination at one level, ensuring dignity, and also combined changing fundamental socio-economic life of lower caste, particularly backward caste and Dalits, broadly what we call Dravidian Block. So this second question, how these two processes became possible? This is what our the book tried to explain. So what is the way in which you explain? Of course, there are a lot of literature done there already exists on Tamil Nadu, range of explain range of questions. But what our book differ from those rest of the work is to show credibly with a certain accepted methodology within economics and political science to show how this mechanism, how this process worked, explaining these two questions that we talked about. So we actually use certain methods which is well known in academics called mixed methods, which is basically nothing but show with the credible statistical evidence of those outcomes in health, education, and a range of other sectors. But those statistical numbers alone doesn't explain the mechanism or the processes. Therefore, we need to go to the detail, asking, meeting the bureaucrats, meeting those people who mattered, accredited bureaucrats who actually part of, say, welfare board, who part of the industrial policy, who were part of educational policy. So we actually interacted with them. With those data and insights, we try to somewhere corroborate with the statistical evidence we mobilized from the range of surveys which is available. So this is called broad methods. But the question here is, again, which is again concerned to the political scientist and economists. Our fundamental question is, eppadi vandu oru diverse caste groups, even among the subalterns, there are so many divisions. Ivangala ella eppadi onnu kondu vandu to make a consensus for certain policies, even if you take a reservation policies or industrial policy or any other policy which matter in terms of changing life and transforming economy, eppadi vandu oru consensus kondu varradhu? Because caste divide society la vandu oru consensus build pandrathu easyana vishayam kedai. Even if this is true for ethnicity or other color based discrimination, society la vandu oru common consensus vandu oru social policy kondu varradhu easyana vishayam, which is the fundamental question that the political scientists are concerned with. So நாங்க என்ன ஆர்கியூ பண்றோம்னா, இந்த புக்ல somehow the Dravidian mobilization, as Mr. Pugal Gandhi mentioned initially, of say Justice Party some extent, particularly it begins more with Periyar, and then in terms of policy interventions it begins with the DMK. Even in Congress time, there was pressure from this Dravidian mobilization on Congress. Some may build this what you call as a common sense, aggregating different caste groups together to make what social scientists call as a Dravidian block. So this Dravidian block was constructed. Just a minute, I missed it. So yeah, this Dravidian people was constructed with diverse caste groups. Everybody has a different demands. Different caste groups have different demands. So you might ask the question, what is the problem? Even the Hindu mobilization also doing this. BJP is doing a kind of Hindu mobilization, aggregating caste groups. You might ask question, adhe the Tamil Nadu Dravidian mobilization mattum organizing or horizontally placed groups build பண்றது வந்து how different is this from Hindu mobilization or some nationalist mobilization? இங்க ஒருத்தர் கேள்வி கேட்கலாம். What we argue in this book is a different kind of mobilization what Dravidian mobilization is. How different is this? The difference is, it is actually every caste groups or those who feel deprived, it is of their asking about their rights, not about talking about some mythologies or ethnicity or some distant glorious history. Not that. It is basically building their concerns, addressing their concerns, addressing their demands, addressing their other range of issues those face, and aggregate them and bring them together. It is essentially changing their fundamental lives, changing their well-being, changing, building an opportunities for them. With those demands, what we call as a Brownian Block. So, this is political science, literature, in fact, social science, what you call Gramsci, or social science. He argues actually, in the modern society, building this block is a key for changing fundamental life of the people. அவர் என்ன சொல்றாருன்னா, இந்த மாதிரி ஒரு டிவைடட் சொசைட்டில கிளாஸோ காஸ்டோ இவங்க எல்லாம் ஒன்னு சேர்த்து ஒரு பில்டிங் a common sense and building a consensus on certain policies against elites or against those who control the resources. In the divide, in the political process, the key for any successful social transformation. So, and the methodology that we use, which is actually the concern of the most of the political scientists today. In US, even for pandemic, it is actually the blacks suffered most. Precisely because health policy still it's controlled by the corporates and do not have any basic services on the led by the state, which is precisely why, because they did not build the consensus among groups to build a health sector. So, இதே பிரச்சனை உங்களுக்கு உலக அளவுல பார்க்கலாம் ஒவ்வொரு ஸ்டேட்ல. இப்ப இந்தியால that's what I said in the UPR BR. It's a really divided on the caste. There was no scope to build this as an horizontal solidarity groups. Some way நாங்க ஆர்கியூ பண்றது என்னன்னா, இந்த தமிழ்நாடு கேஸ்ல we try to build, I mean that's what the Dravidian parties, particularly starting with Periyar, actually build that. I think he was instrumental in many ways actually building that common sense. So, what are the character of this common sense? Use what does that common sense mean? Which is simply basic to say, Tamil Nadu ஒரு ஆட்கள் வந்து social justice reservation எடுத்து யாரும் politics பண்ண முடியாது. Obviously, you need to support certain, the social sector, social justice policies, any kind that way. You can call that affirmative action policies இருக்கலாம், அல்லது women rights இருக்கலாம், அல்லது transgender rights, rural urban disparities, range of things one can call as a broad social justice policy. So, you can't do politics in the state against this set of policies, which is somewhere become common sense. But how different this common sense say that exists in the say in the UPR BR, because there you can't build, still ஒரு acceptance இல்ல அந்த பாலிசிஸ்க்கு. இங்க ஏதோ ஒரு வகையில ரிலேட்டிவ் சென்ஸ்ல ஒரு அக்செப்டன்ஸ் இருக்கு. அந்த அக்செப்டன்ஸ் உருவாக்குனது இங்க நடந்த சோஷியல் மொபிலைசேஷன். அது சிவில் சொசைட்டில இருக்கலாம், கல்ச்சரல் டொமைன்ல இருக்கலாம், எல்லா டொமைன்லயும் இது வந்து ஒரு செட்டப். So if you look in the policy and the political mobilization of the DMK coming into power in the 60s, and which actually some way translated of economic and social life of the people. That's a broad argument. இது எப்படி வந்து இப்ப இது வந்து கேள்வி கேட்பாங்க என்னன்னா, even political scientists or economists, even some policy makers, நீங்க எப்படி வந்து ஒரு சக்சஸ்ஃபுல்லான நடந்த விஷயத்தை, ஈவன் சோஷியல் செக்டர் நடந்த விஷயத்த இவங்க இந்த ஐடியாலஜி இந்த சோஷியல் மொபிலைசேஷனால தான் நடந்தது அந்த பாலிசி, அது நடந்தது அந்த இன்டர்வென்ஷன் அப்படின்னு எப்படி நீங்க வந்து ஏ கனெக்டட் டு பி அப்படின்னு ஒரு கொரிலேட் பண்ண முடியும் அப்படின்னு ஒரு கேள்வி உண்டு. ஃபார் இன்ஸ்டன்ஸ் ஹெல்த்ல வந்து ஒரு இன்டர்வென்ஷன் நடக்கு, ஒரு பெட்டர் பிஎஸ்சி கட்டுறாங்க, நிறைய பிஎஸ்சி கட்டுறாங்க, நிறைய டாக்டர்ஸ் உருவாக்குறாங்க. அந்த டாக்டர்ஸ் உருவாக்குறதுக்கும் இவங்க பேசின ஐடியாலஜிக்கு என்ன சம்பந்தம் அப்படின்னு ஒரு ஆட்கள் கேட்கலாம் கேள்வி. அஃப்கோர்ஸ் தெர் இஸ் நோ ஒன் டு ஒன் கரஸ்பாண்டன்ஸ். இன் கால் எக்கனாமிக்ஸ் டேர்ம்ஸ்ல பார்த்தோம்னா ஒரு எக்கனாமெட்ரிக் அனாலிசிஸ் வச்சு ஒரு ஈக்குவேஷன் எல்லாம் போட்டு பண்ணுவோம். அந்த மாதிரி ஒரு ஈக்குவேஷன்ஸ் கிடையாது டெஃபினெட்லி. பட் இஃப் யூ லுக் அட் அக்ரிகேட் ஆல் பாலிசிஸ் from say Justice Party to when Periyar is pressure on Kamarajar around Congress and later DMK and ADMK coming into power, if you look at map all policies together, you certainly find அதுல வந்து ஒரு பேட்டர்ன் டெஃபினட்டா எமர்ஜ் ஆகுது. அந்த பாலிசிஸ் நாங்க என்ன டிவைட் பண்றோம்னா, we divide that policy into two component which we call as a economic popular and social popular. What we mean by social popular ஒண்ணு கிடையாது. இது எந்த பாலிசிஸ் வந்து ஒரு ஃபண்டமெண்டல் ரூல் இருக்கு சேஞ்சிங் தி லைஃப். ஃபார் இன்ஸ்டன்ஸ் ரிசர்வேஷன் பாலிசிஸ் சொல்லலாம், அல்லது உமன் ரைட்ஸ் சம்பந்தமான விஷயங்கள், ஈவன் இப்போ இந்த சொத்துரிமை கொடுத்தாங்களே அந்த விஷயத்த சொல்லலாம், அல்லது ஈவன் இந்த லேண்ட் ரிஃபார்ம் விஷயங்கள் சொல்லலாம். ஸோ அந்த மாதிரி விச் ஆக்சுவலி சேஞ்சஸ் த ஃபண்டமெண்டல் characteristic of state, which is the government, and changes even the governing structure itself, democratizes more opportunities. And the policies aggregate panni, we call as a social popular. Then there is also freebies, which are centrally considered to be a negative role, which is like, Tamil Nadu known for a freebies culture. Corrupt பண்றாங்க people அப்படின்னு ஒரு argument உண்டு. But not necessarily so. There now enough evidence இருக்கு that actually changes people life as well. The economic PDS வந்து ஒரு காலத்துல actually played a much better role in of many things actually in terms of ending anger and other range of issues. So இந்த மாதிரி freebies சொல்றது எல்லாமே now seen as a social policy, consider acceptable social policy. But 20 years முன்னாடி 30 years முன்னாடி தமிழ்நாட்டில் நடந்த policy வந்து people were not willing to accept. So இன்னைக்கு வந்து ஒரு consensus build ஆயிருக்கு among the academicians, among the development economists that given this global situation, given the global economic architect, this kind of policies are very important. This is something even welfare board எடுத்துக்கோங்க. I think Tamil Nadu is probably after Kerala in certain sector, Tamil Nadu is one of the few states, even not just in India, in the entire developing country circle, build that welfare board. Welfare board for informal sector, some 17 boards. How much those boards are working, that's a different question. Even this idea of having a welfare board for the informal sector is one of those radical act in those times. 20 years முன்னாடி இது நம்ம யோசிச்சே பார்க்க முடியாது. இன்னைக்கு அது வந்து global levelல important question பார்க்கப்படுது. So what we are trying to say is essentially இந்த பாலிசிஸ் எல்லாம் நீங்க அக்ரிகேட் பண்ணி பார்த்தீங்கன்னா லாஸ்ட் 70 years உடைய பாலிசி நீங்க அக்ரிகேட் பண்ணி பார்த்தீங்கன்னா there is a pattern. Definitely அந்த பேட்டர்ன்ல ஒரு social justice or ஒரு some sort of freedom, ensuring dignity and opportunities, democratizing opportunities, இதெல்லாம் ஒரு காம்பனண்டா அதுல இருக்கு. அதுதான் எங்களுடைய அனாலிசிஸ். இது purely evidence based, not just talking about some air, just looking at some manifesto and we are talking with all evidence we are talking this. And in the policy interventions வந்து ஹெல்த்லயும் எஜுகேஷன்லயும் எப்படி நடந்ததுன்றது மட்டும் I just confine that, I just illustrate this. எப்படி இது நடந்துச்சுங்க, ஏன் இந்த ஹெல்த் அண்ட் எஜுகேஷன் மேட்டர்ஸ்னா this considered to be level playing field. particularly இந்தியாவில் இது ரொம்ப இம்பார்ட்டன்டான விஷயம். ஏன்னா even if you look at when we got a freedom, comparable economic position உள்ள countries கூட they went for the primary education. Even China, which is actually a different political system, but it ensured a mass-based education. Similarly, even the democratic countries, similarly like India was, some way very good, vibrant democracy in many ways of ensuring full franchise for everyone. This is a remarkable thing. Most of even Britain and other countries, voting rights ellarum kudukala. India actually got freedom with the voting rights. But on the voting rights, when they did not translate into a changing basic life of people, say education or health. So that's what even Ambedkar says when we are entering the contradiction. When he was talking about submitting the constitution in the assembly debate, he says this: we are entering the contradiction. Nam vandu voting ellarkum voting rights irukko, but they are still unequal in terms of social and economic life of the people. So and the structure inherited in India. So key component, one of the key component democratizing this is the education. So அப்ப வந்து இது ஏன் இங்க நடக்கல அப்படின்ற ஒரு கேள்வி வந்து பொலிட்டிக்கல் சயின்டிஸ்ட் மத்தியில பயங்கரமா இருந்தது. This is in 60s 70s I'm talking about. There is someone called Myron Weiner. He is a famous political scientist, was from MIT. He did a field work among bureaucrats, planners, educationalists. ஏன் நீங்க வந்து பிரைமரி எஜுகேஷனை கொண்டு வரல? எல்லா கண்ட்ரிஸும் பிரைமரி எஜுகேஷன் கொண்டு வந்தாங்க, எல்லாருக்கும் கொடுத்தாங்க எஜுகேஷன், நீங்க ஏன் எஜுகேஷன் எல்லாரும் கொடுக்கல அப்படின்ற ஒரு ஆர்குமெண்ட் செக் பண்ணும்போது he went to the field, talked to people, he came out with a book. Then he said, look, இந்தியாவில் வேற இது நடக்கலாம், there is some kind of elite bias in the sense and the mental manual labor, and why would we go for இவங்க படிச்சவங்க என்ன பண்ண போறாங்க, only we need to build a nation, let's build more IITs, IIMs. Not much talk about because we have limited resources. அதனால அந்த resource எல்லாமே they build on the higher education at the cost of primary education. This was a key concern for many. Even Amartya Sen argues why India could not become a successful, particularly in social development, is precisely because we neglected higher education, neglected the primary education. இந்த elite bias வந்து தமிழ்நாட்டுல some way seems to be tackled. இதுதான் வந்து question, எப்படி இவங்க பண்ணாங்க? Because in the 50s itself, we some way ensured the primary education. We also looked at the budget data of the 50s. If you look at the total educational budget, there is a disproportionate component was going towards the primary education. So if you 50s in the primary education question tackle பண்ணதுனால address பண்ணதுனால 60s 70s Dravidian parties வரும்பொழுது they could transfer this resource from once, because you ensured already some level of enrollment in primary and secondary education, could move to higher education. அதுக்கு இன்னொரு காரணம் என்னன்னா, இங்க இருக்க bureaucracy also change of its composition, which is if you look at the 50s or even the 40s and 50s, the social composition of bureaucracy was completely skewed with the elite. I mean, in the Tamil Nadu context, you would see the Brahmins, maybe the other upper caste elites. Whereas in 70s and 80s, the bureaucracy started gradually changing, more from the sort of MBCs, OBCs, and Dalits. So in the bureaucratic change also played a larger role of ensuring certain social policies. Because, in the social policy changes in the composition of bureaucracy, even if you take the other, doctors, teachers, the composition matters. There is in literature, there is an argument among the sociologists. They call as a weak ties. The weak ties அதாவது நீங்க ஒரு ஸ்கூல்லயோ ஒரு ஹாஸ்பிட்டல்லயோ ஒரு bureaucratic structureலயோ அதாவது similarly placed people இருக்கும் பொழுது access பண்றது ஈஸியா இருக்கும். If you have a people and the institutions are controlled by the elite, அது access பண்றது ஈஸியான விஷயம் கிடையாது. They actually did an experiment to show when you have a similarly placed people, and particularly from the subaltern groups entering into this governing structure, actually plays a much role of ensuring access to the many. So this is actually was done in the education. இதனால என்ன நடந்ததுன்னா, இந்த outcome என்னன்னா, definitely not only you ensured relatively higher enrollment ratio in primary and secondary education, also ensured better enrollment in higher education. So remarkable. Today, if you look at around 50% of youth between 18 to 23 are in higher education institutions. Of course, there are problems. Some colleges, some of the colleges are seen as really bad, doesn't meet standards. That's a different question when it comes to the quality of education. That actually we'll talk about in later point in time. But still, ensuring this quantity terms of at least having a degree of who actually had never anything in his life really mattered. So that level of that actually became possible through the reservation policies. In other, if you look at some of the reservation policies, very interesting. I think probably is the Tamil Nadu the only state in which actually experimented all kind of deprivations. Many people think Tamil Nadu only actually promoted caste-based reservation. No, not really. If you look at Kalaiyarasan terms, even 2006, there was a committee, we even met that person who chaired the ex-Anna University vice chancellor. I'm not getting his name. Actually, he tried to even arrest the gap between the rural urban and the first generation daughters and sons. So you actually try to address all kind of deprivation. It's not just a caste-based deprivation, because the deprivation manifests in many ways. So ஏதோ ஒரு வகையில் இவங்க எல்லா எக்ஸ்பெரிமெண்ட்டும் பண்ணியிருக்காங்க. அது ஒரு வகையில் to ensure inclusion in the education domain. So இந்த elite bias address பண்ணி ஒரு அளவுக்கு democratize பண்ணியிருக்காங்க education opportunity. இந்த democratizing education opportunity really played a role in labor market. If you look at the software sector, you will find people from across caste groups. I think probably in southern states more, particularly in Tamil Nadu more. Even the kind of migration would differ. That is largely because of this entry in the higher education. Similarly, even if you look at health, which is actually the biggest debate in the country actually, why, despite having India is a superpower, India has actually had a better growth pattern since 90s in particular, but did not produce a reasonable health infrastructure, which actually we are suffering because, if you look at the pandemic, the way we see the lapse in the oxygen demand and the health infrastructure really crumbling. Why we couldn't build, despite having a better economic growth since 90s, forget about before the Nehruvian policies. Economics mathila or consensus, particularly health economics mathila, they think again there is an elite bias, which actually began from the 50s onwards, Nehruvian policy onwards. In the sense, they concentrated more on the curative healthcare, but not in the preventive healthcare. Preventive healthcare, in the sense, more of the primary, health centers, ensuring access to people from, subaltern groups of the basic health facilities. If you prevent, you actually control many diseases that way and ensure the basic access to the healthcare. But actually, they build the bigger hospitals, but not on the ensuring for the poor and subalterns in many ways. This elite bias is very much operating in health also, which I actually mentioned the Myron Weiner in the case of education. So Tamil Nadu actually seems to be having separate public health department from Justice Party onwards, which is actually partly linked with the colonial state also. There's some story on it. We can talk about in detail how that public health policy evolved. But certainly that separate department of public health personnel remarkably worked. இதுல இன்னொரு அடிஷனல் ஃபேக்டர் என்னன்னா, வாய் நீங்க கேள்வி நிறைய ஃப்ரெண்ட்ஸ்க்கு கேள்வி இருக்கலாம், ஏன் தமிழ்நாடு மட்டும் இந்த நீட் வந்து அப்போஸ் பண்ணிட்டு இருக்காங்க, ஏன் மற்ற ஸ்டேட்ல இந்த நீட்டுக்கு அப்போஸ் பண்ண மாட்டாங்க? Why? Because I think probably Tamil Nadu, the only state you would find a diverse composition of doctors and health personnel. In the diverse group of diverse, socially inclusive doctors and health personnel, why it mattered? It mattered not just because they have to be there. It also mattered அந்த மாதிரி ஒரு டைவர்சிட்டி இருக்கிறதுனால தான், அந்த மாதிரி ஒரு சோஷியல் கம்போசிஷன் இருக்கிறதுனால எல்லாருக்கும் ஒரு ஹெல்த் ஃபெசிலிட்டிஸ் மேல ஒரு அக்சஸ் இருக்க பாசிபிலிட்டிஸ் உண்டு. இது வந்து வெல் ப்ரூவ்ட் தியரி. ஸோ சம்வே இவங்க பண்ணது கூட இன்னொரு விஷயம் என்னன்னா, they actually build that through the incentive structure. It's not that நீங்க இந்த ரிசர்வேஷனால அனுபவிச்சிருக்கீங்க, therefore you have to do certain work அப்படின்ற கண்டிஷன் இல்ல. Of course you build an incentive in the sense நீங்க இத்தனை வருஷம் ஒர்க் பண்ணீங்கன்னா you get a certain promotion or you get a certain course in the super specialty courses in the range of ways. So somewhere the NEET system was actually trying to dismantle all of this, because we had a distinct way. People would say inga irukka doctor வந்து comparable to doctors in Stanford or doctors in New York. Why should I compare with them? I need doctors who actually tackle with my people. So I need not to compare with the doctors in New York. There may be hospital. India hospitals, there are some doctors comparable to doctors in New York. But what we need is a doctor who actually does a job in district, some dry district in Viluppuram or Dharmapuri or Krishnagiri, where nobody goes there. Actually, I visited a place in Yelagiri, a small health center. It was well-functioning health center. You cannot find this well-functioning health center anywhere in the country. Maybe probably some extent in Kerala. But Kerala, again, health system is different. Again, there's a different story altogether. So somewhere in the health system, they really actually did. Of course, we have a problems now in the corona, which is something beyond our control. Certain things are still we are trying to manage even our resources. But still, this, if you look at the trajectory, it's still relatively better, precisely because controlling or addressing this elite bias. One, I want to say one more thing in this health thing, which is about the drug policy, which is very much popular and well sort of appreciated policy, which is what it's done by Tamil Nadu Medical Service Board, which is basically ensuring medicines at the free of cost at the government hospitals and a much lower price in the private hospitals, which is because they actually control centralized mechanism to test all the medicines and check the quality, price, and base some. This actually ensured that no one spends more money from their own income, particularly poor and subalterns who access the government hospitals. They don't spend money from their own pocket buying the medicines, which is not the case in most of the state. Many people actually laugh at us, what's the big deal about? Which is not a big deal. It's really big deal to ensuring medicine, basic medicine in the government hospital, which is not possible in many states. So அதனால என்ன ஆகுதுன்னா, வீட்டுல this is in economic literature, there is something called out-of-pocket expenditure, which is one of the lowest in the state. If you go for the hospitalization, of course, some people would argue there are huge issues, insensitivity in government hospital. That is a different question. We need to fight for, collectively struggle for ensuring better life or better functioning of those hospitals. But relatively, these were working precisely because two things I said. One is ensuring socially inclusive professionals, doctors, and other aspects in the health infrastructure. Also addressing the elite bias, ensuring the basic public health infrastructure, which is not done in 1 day or 2 day, 1 year or 2 year. Began in the Justice Party some way, but actually it was done more in 50s and 60s, particularly when, if I have to mention this, it was actually, in fact, the first state planning commission was formed in India, which is Kalaiyarasan period, which was in 72-77 time. And in fact, that he actually, after forming this planning commission, he formed a health committee, which is famous, I would say, Adisheshia and MIDS, and there are other big guys who are in the health, health doctors or the economics in the country. It built a task force to build this and give the suggestion. Somewhere there was an attempt. So therefore, it cannot be denied. So what we are trying to argue is, many people would say, how do you actually make a case? Someone has done in policy, you take a credit. Always say Dravidian parties have done. Actually, which is true. I mean, if you aggregate all this policy, you will certainly find a pattern. So, இன்னொரு question என்னன்னா, இவங்க மட்டும் welfare மட்டும் தான் பண்ணாங்க. growthல எதுவும் பண்ணல அப்படின்னு சொல்லி. No, we actually say we have done much better, in fact, in the growth. I think I would now invite Professor Bhaskar to explain how that became possible in the state.